بسم الله الرحمن الرحيم. My topic is the role of arthroscopy post total knee arthroplasty. Total knee arthroplasty is successful for end stage of osteoarthritis knee. However, there were approximately 20% of cases dissatisfied following primary total knee. I classified those cases into two groups. Group 1, cases with known diagnosis. I will give you some examples. Malposition of prosthesis, and this could be diagnosed by CT scan. Infection is a devastating complication of total knee arthroplasty. The next is aseptic loosening, and this could be diagnosed by the plain X-ray. You can notice the radiolucency, periprosthetic, and also there is reduction in the joint space because of the polyethylene wear. Lateral patellar instability. This is easily diagnosed by the history, the clinical examination, as well as the plain X-ray. In this lady, I performed proximal and distal realignment for her. Now I shift to group 2, cases with unknown diagnosis or with negative workup investigation. Before the journey to the unknown, I borrowed the idiom that say, the eye sees by the arthroscope what the mind knows. That is why in the next pages, I will shed some lights on the possible cases of undiagnosed painful total knee arthroplasty. Such as meniscal regeneration or pseudomeniscus. 1/3 of cases is related to the former tissue, and 2/3 of cases represent scar tissue. Second, retained PCL stump, and these cases treated by lysis, arthroscopic lysis, by vapor, by shaver, and so on. The third, hypertrophic synovitis impingement, as seen here between the femoral implant and the liner, as well as the fat bed. Number 4, persistent synovitis due to infection, hemarthrosis, loosening, wear, debris, and metal hypersensitivity. Now, number 5, the cyclop lesion, or famous as patellar clunk syndrome. Etiology is multifactorial. 0% to 7.5% mainly related to femoral design. New designs are giving us satisfactory results. The next is the recurrent hem arthrosis up to 1.6% because of impingement of synovial proliferation, PVNS, arteriovenous fistula, false aneurysm, patient used anticoagulant and or antiplatelets, patient with diabetes or hypertension or both. You can notice here the reflection in the femoral prosthesis of granulation tissue with spots of bleeding. And there, after cauterization. Number 7, medial abrasion syndrome. It is a fibrotic medial plica in the medial gutter. Treated by anteromedial release arthroscopically. Number 8, arthrophosis. Define arthrophosis if stiffness more than 10 degrees extension and less than 95 degrees flexion in the first 6 weeks post-operative. No consensus on its etiology. It is also multifactorial. You can notice here the fibrous tissue covers the notch and here after shaving, and there a lot of fibrosis in the suprapatellar area treated by shaver or otherwise vapor. And there is intervening tissue between the femoral and the liner and also in the gutter. And the last is after shaving. The last one is the popliteus tendon dysfunction or popliteus tendonitis. It causes posterolateral corner pain due to pinching of popliteus tendon caused by lateral osteophyte, lateral prominence of femoral component, posterior prominence of tibial tray. What about the efficacy of knee arthroscopy post-total knee arthroplasty? The use of arthroscopy following total knee is not new, since Edward Campbell in 1987 studied 8 patients had arthrofibrosis with satisfactory improvement in flexion range. In Saul, Scott, Kelly, and Dedush in 1997 concluded that arthroscopy was useful with diagnostic efficacy 97.5% in 40 knees and therapeutic efficacy of 75% without recurrence. What about the difficulties? Arthroscopy intervention is technically demanding because of the mirror phenomena due to reflection of the picture of the instrument on the surface of the femoral implant that makes orientation difficult. Difficult triangulation also, avoiding implant or lens scratch. Just 2 slides. Thank you. Arthroscopy after arthroplasty is not totally risk-free. The most crucial is infection. Infection rate was 0% in most reports, 0.4 in the study of Killinger, to 6.3 of Lovro et al. Complication of knee arthroscopy after knee arthroplasty was 0.5. At the end, despite arthroscopy following total knee arthroplasty has shown promising results, the surgeon must discuss and counsel the patient in the increased risk of potential infection and the need for future revision surgery, although it is rare. Thank you very much.